Hello everyone and welcome to my channel. My name is Maria and on my channel I create videos around everything nursing. I also have a handful of lifestyle content. I am trying to get to 10k subscribers, so I'd really appreciate it if you guys subscribe to my channel and also if you gave this video a like. Not only does it help with the growth of my channel, it also helps with the YouTube algorithm by telling YouTube that you guys would like to see more videos like this. As usual, this video is in partnership with www.nursingperfstatement.co.uk, so make sure you check that website out if you haven't done so already. In this video, we are going to be talking about what you can expect during your student nurse online interview. So if you've got your interview on Microsoft Teams, with Zoom or with Skype or with any other webcam software, I'm going to be talking you guys through what you can expect from the beginning all the way to the end, and I'm also going to give you guys some pointers on what you should do and most importantly what you should not do. So let's just start. So you've been invited for your nursing school online interview. You've done all the relevant prep work beforehand in terms of making sure that your computer's compatible with the software. You've made sure your camera, your mic and your speakers work, and that you've given the relevant apps permission to use these applications on your computer. Interviews at 12:55. I know you guys have taken my advice from my previous video, and at 11:30 you were ready. At 11:55 you were logged on, meaning that at 12 o'clock everything was ready, everything was set to go. So now you guys are in your nursing school online interview. First things first, generally what will happen, the person who is interviewing you will introduce themselves to you. You'll do the same as well. And they'll also, some of them will like to confirm that you are in the room by yourself. One quick way of doing that is just, turn the camera to confirm that you're in the room by yourself. And really it's kind of also to confirm that you guys don't have posters behind the cameras that have, the 6Es and everything and, little pointers, kind of just to make sure you guys aren't cheating. That doesn't always happen, but sometimes it does happen. They do like to confirm that you are in the room by yourself. They also want to confirm that you are who you say you are. So I would recommend having your passport with you and or your driver's license and or your birth certificate. That way, when they want to confirm that you are who you say you are, you can just, put your birth certificate or your ID to the front of the camera, and they'll probably take a screenshot of that and then put that in their records so they can confirm that you are the right person. Because not that I've ever heard that it's happened to undergraduate nursing students, but I've heard some stories of people having online interviews, and they've got a book with them in the corner, they've got a calculator when they really shouldn't have a calculator, and basically they're kind of cheating during their interview. Not that we expect any of you guys to do that, or that not that I think any of you guys are planning on doing that. Once you've done all the technical checks, you've confirmed that you're by yourself, you confirmed who you say you are, and you've also confirmed what it is that you're studying or what you have applied for. Sometimes they may ask you for any relevant certificates that you have. For example, if you have several GCSEs, or if you have your A levels or AS levels, they may also ask you to confirm this with them by showing it to them. So if you do have any relevant certificates, then make sure at the minimum you have any relevant certificates and you have at least one form of ID with you at the start of your interview, so you can get that out of the way. Because just imagine they say, hey, can you just confirm who you are? Show me a license, I know your passport or whatever, and you can't find it. You're rummaging all around the house trying to find it. Just make sure you have all of that with you, because it really just lets the person who's interviewing you know that you are a professional person, you're ready and you're able to think ahead of the game. Just because you received an email inviting you for an online interview, just because they didn't say that you don't need your ID or you don't need any relevant certificates, doesn't mean you should not have that ready with you. So once you've done all of that, one of two things tends to happen. A, they'll either go straight into the individual interview, or two, they will show you a presentation of what to expect. Expect to have a presentation if you've been told that not only will you be having a group interview, you will also be having an individual interview. So generally the presentation will basically be kind of like their sales pitch as to why they're the best university or why they are the best kind of organization for you to go with in terms of your nursing degree or your nursing associate or apprenticeship program. And expect the presentation to be anything from like a minute long to anything from about 15 minutes long. And make sure you are engaging with that presentation, whether it's cheesy as it sounds, whether it's smiling, nodding your head, just show that you are engaged. Best believe that during the presentation you necessarily won't be able to see the person who is interviewing you, but best believe on their screen they can see everything that's going on. So if during, you know, the 10-minute presentation and the microwave goes off and then you're quickly eating some takeaway because you think they can't see you and it's only the presentation, don't do that. Just remain professional and present and engage. Engagement is so important. Remain engaged at all times. One way you can engage with this video is by giving this video a like and subscribing to my channel if you haven't already done so. So once that presentation is over, more than likely you will go into the individual interview and they will start asking you questions, obviously in relation to the degree that you are applying for. In this video, I'm not going to go through a whole list of questions that you may be asked. However, I do have another video on my channel where I literally go through 40+ interview questions that you may be asked during your nursing school interview. Please keep in mind that questions aren't going to be, well, they might be, can you tell us what the 6 C's? But a very simple question such as, can you tell us what the 6 C's are, can be worded in so many different ways. I can think of like 1,000 different ways that that simple question can be worded. They can say, can you name 3 skills that nurses have? They can also say, can you tell me a skill about yourself that you think is suitable to the role of a nurse? They can also say, can you compare and contrast 2 nursing qualities? So don't expect the questions to be as straightforward as what are the 6 C's or what are the 10 commitments or what is the role of a nurse. And I don't want to say that they're trying to trip you up, because they're not trying to trip you up. They're just wording the questions in a professional manner because this is a professional situation. Imagine if you went to a nursing school interview and they asked you, what are the 6 C's? What are the 10 commitments? What's the role of the nurse? How many years is this degree? Yes, those questions are very easy and you're going to be like, yes, 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 the questions were easy. But then you're going to be questioning the quality. Well, if it was me anyway, I'd be questioning the quality of the actual university. If all you're going to ask me are very basic questions, or if the questions are going to be worded in such a basic way. So it's very important that you practice not only straightforward interview questions, but you also practice more complicated interview questions, such as, can you tell me about a time when you've had to teach someone something new? Can you tell me about a time when you received feedback that you weren't very happy with? Those questions are very relevant to nursing practice. They're just worded, you know, in a different way. I also want to say, make sure you practice your interview technique. If this is the first interview that you've ever been to, whether it's, you know, your first job interview, your first nursing interview, your first whatever interview, if it's the first interview that you've ever been to, I will suggest making sure that you are familiar with the STAR technique. STAR basically stands for situation, task, action, results, and then there's the extra R at the end, reflection, because reflection is very important in nursing practice. So when you're giving the responses to some of your answers, try and add an element of reflection. For example, what is it you learned about yourself in that situation? What's one thing you would have changed? What's one thing you would take going forward? The person who's interviewing you doesn't directly have to ask you what's one thing you would have changed. Let's just say you were given a scenario. At the end of the scenario, you can say, looking back, one thing that I think we did really well, or one thing in that project that worked. So yeah, make sure you're familiar with the STAR acronym. Another thing that I want to add in terms of like the types of questions that they will ask you is that please understand that if you are asked a question that you don't understand, there is nothing wrong with saying, hello, I misheard you, or no, okay, if you didn't mishear them, don't say that. But if you simply did not understand a question, just say hello. Well, you don't say hello, but just say, hey, can you repeat that question again? I just want to make sure that I've heard what you said properly. Or hello, why do I keep saying hello? Or you can say, is there a, if you're really, really struggling, you can say, is there a way that you can reword that question that will make it easier to understand? They may have some sort of list that is an adaptation. I can say, coming from someone who has been in that situation, and from someone who's also been in a situation where I have interviewed people, not really in relation to nursing, but I have interviewed quite a few people. We do have a list of the main questions that we want to ask, and if we can see that the person is struggling with answering the first question, there's also an alternative list that has the same question but it's worded in a way that's easier, and they also have cues that they can refer back to. Another thing that I want to add is that don't feel as if that they're trying to trip you up, or they're trying to kind of be sneaky or go behind your back. They're not trying to do that. It's a professional situation. They're just asking you questions, and hopefully you guys will be able to give the correct response. This is a very, very, very important thing that I want to add. I don't know why I'm smiling. I'm smiling because I'm happy. This thing that I'm about to share with you guys is very important, so make sure you listen to what I'm saying. And one mistake that I have seen time and time again from my experience when interviewing people, and it's so frustrating because it's like the answers are directly, we have not given the answers, but we have told you what we're going to do. And one mistake that people make time and time again is that they do not look at the essential and desirable criteria, and or they do not pay mind to what is being assessed at different points of the interview. Say for example, you have your individual interview and you also have your group interview, or say for example you have 2 individual interviews and they've told you this is what we're going to look at in this interview, and then we're going to move on to these types of questions. People make the mistake of thinking, oh, what they're looking for in the individual interview is the exact same thing as what they're looking for in the group interview, and as a result people don't tailor their responses to the individual interview and they don't tailor their responses to the group interview. From what I've seen in my own practice and in my own experience, as you know, in group interviews are where you tend to see, or is where they tend to assess you more for your team working. They tend to assess you, or more emphasis is placed on your team working skills. More emphasis is also placed on your critical thinking. I'm not saying that just because it's a group interview, they're only going to look at critical thinking and they're only going to look at team working, and they're not going to assess you for that in the individual interview. But it may have, I'm not saying it will have, because every university, every nursing school operates differently, but it may have a different weighting. But like I said, from what I've seen and from my own experience, critical thinking, a greater emphasis tends to be placed on critical thinking in the group interview. And when I think of critical thinking, just off the top of my head, I'm thinking of things like analysis, being able to get your point across, being rational in what you're saying, being able to reason, being able to think logically, being able to present your ideas in a clear and organized, a structured and a coherent manner. When I think of critical thinking, I also think of, you know, taking ideas from different places and not being closed-minded. Critical thinking also involves being able to assess the reliability and the validity of the information that you've been presented with, and also the information that you bring to the group and that, you know, other people may bring to the group and they bring to the discussion. So yeah, make sure you pay mind to that. I do know that some universities, not all of them, because you know, not all of them, they're not all the same, but some universities, they are saying this is our essential criteria. By essential criteria, they basically mean that these are the skills that you must have. This is what we must see during the group and the individual interview. And then by the desirable criteria, they basically just mean these are things that we would like to see. If you don't have it, then don't worry. We will, if we do give you space, that's something that we will work upon. But yeah, essential is things that you must have, and desirable is things that you don't really need to have. Like essential is like the fruit and veg. You must have fruit and veg. But the desirable is like, you know, the sweets and the cheese that you don't necessarily need to have, but it's okay. We will encourage it. You go onto a university website or that university website and look at if they have published an essential and a desirable criteria. Make sure you have a look at that, because honestly, that will just help you to get your mind right and help you to kind of structure, like, okay, I know in the individual interview I'm really gonna push for this, and I know that in the group interview I'm really gonna push for this and this. Again, do not interrupt. Understand the difference between interrupting and interjecting. Interjecting may be a bit difficult just because it is online and the time lag may not allow for it, especially if not only your internet speed is not great, but if everybody else's internet speed is not great, then I don't really recommend interjecting. But showing that you agree or disagree with your points, or with points with hand gestures, smiling and all of that stuff will really help. But at the same time, it doesn't negate the need to make sure that what you're actually saying meets what they want. Smiling, hand gestures and all of that is all good and stuff. It will support you, but like I said, it doesn't negate the need to make sure you guys practice. So now we've kind of gotten through the main bulk of the interview. We've introduced ourselves, shown the relevant documents, we've watched a presentation or two, we've done the individual interview, we may have done the group interview if that was included, and now it's time for the numeracy test and also for the English test. How this may happen. One, it may not happen. Maybe they've already emailed you a link that they want you to complete before you even got invited to the online interview. Or two, they may put some questions up on the screen and they say, okay, these are the questions that we put on the screen. You've got, 10, 20, however long to complete it. Once you've completed it, you'll show it on the screen, and then they'll take a screenshot of it, and then they will mark it at a later date. As I have gone through the video, I've tried to do it in a very structured way in terms of introduction, presentation, individual, group, and then tests, but it may be done in a different manner. Maybe you log on, you show yourself, you show the relevant paperwork, and then you may have the numeracy test straight away. Like I said earlier on in the video, what they're trying to do, they're trying to make the online interview be a direct reflection of what would have happened if you actually got invited out to the university. I know that from my experience when I was a nursing student, what actually happened at some of the interviews, which I think was mean, what you did was you'd go in for the selection day, they'd give you a timetable of what would happen, you'd have a little presentation, you'd show your ID and stuff like that. And at some interviews, I think at like maybe 1 or 2 interviews that I went to, first things first is the maths and English test. And they did have like a couple of their students who are already nurses, who they were paying for like a day of work. They'd quickly mark, your maths and English test. And if you failed it, they'd just say to you, hey, sorry, you cannot continue on to the rest of the selection day. You can't continue to the rest of the interview day. And hey, if you have passed it, then okay, this is the next stages. And yeah, I'm only saying it because, like I said, they're trying to make sure that the online interview mirrors what they would have done in actual real life. So do not be surprised if you go straight in, you introduce yourself, you show the relevant documents, and then they do a maths test, and then they say, okay, you've made it onto the next stage, and then you go on to the next stage. It's not always going to be in that particular order, but that is how some universities do it, just so that they're not wasting your time, and also so that they're not wasting their own time, because time is valuable. Like I've said, making sure you have any relevant documents, at least one form of ID, unless they've emailed you telling you otherwise. Making sure you have, any relevant certificates with you. I've also talked to you guys through what you can expect during your individual interview and during your group interview, and making sure you've read the essential and the desirable criteria, and also making sure you're looking at any marking scheme that they may have, not all of them do it, that they may have published on their website prior to you going for your online nursing school interview. At the end of every interview that I've ever been to, the person who is interviewing you, I'm just checking the time, the person who is interviewing you will more than likely say, do you have any questions? And the worst thing, this is coming from someone who has interviewed so many different people, the worst thing is when they ask you a question that you have already answered. Whether you've already verbally told them, or whether you've emailed them a document in preparation for your nursing school interview and they haven't read that document, it is so annoying, because it's like, I've literally given you this information. If you really want this place as much as you say you want this place, you would have read that question, you would have read that document, or you would have taken relevant notes and ensured that when you did have the opportunity to finally ask me a question, you did not ask me a question that I have basically already given you the answer to. So, at the end of the interview, they're going to be like, oh, role play. Bob, do you have any questions? Yeah, I want to know how long the degree is. Oh, yeah, I want to know how much it cost. Oh yeah, I want to know what field of nursing this is. What? What? Or even questions that may not be so obvious, but they may have published on their website, are the placements block or are they integrated with theory? Because most universities do publish this on their website. Fair enough, if it isn't on their website, then yes, it may be worth asking it during the interview. When asking a question at the end, you want to make sure that the question is specific to your learning and also specific to the learning that the university will be providing. One question is, what is the culture of learning like at this university? What's the culture of learning like at the placements, at the hospitals that you work with? One of the reasons why I've refrained from giving you guys a list of questions that you guys could possibly ask the interviewer at the end of the interview is just because I don't want to give you guys questions and then you're coming out asking the person a question, and then the quality of the question that you're asking doesn't match the quality of the responses that you guys have been given throughout the interview. So yeah, if you've done all the relevant preparation and you're generally interested in, you know, being a student at this institution, then the relevant questions will hopefully come naturally. Anyway, I think I've kind of covered everything. Anyway, that is it for this video. If you haven't already subscribed, make sure you subscribe to my channel. Also give this video a like, and thank you guys so much for watching, and all the best with your online nursing school interviews. Bye.